EpiPen training brought to you by the professionals at Prepare to Act. Find out more information at preparetoact.com. As we begin our epinephrine training, keep in mind that the word EpiPen is a brand name and is a description for an auto-injector that injects epinephrine into a person that is having a severe allergic reaction. Epinephrine will only buy you time, so you still need to call 911 as soon as possible. Keep yourself calm and your mind present. Keep the patient calm and focused. This will help their breathing. Epinephrine is a prescribed medication that does not need to be prescribed to the person having the reaction. The dose or amount are all the same in all auto-injectors. It's imperative that you get the epinephrine into the person having the allergic reaction as quick as possible. What is an EpiPen? An EpiPen is the brand name of a device that delivers the drug epinephrine, which is a life-saving medication used when someone is experiencing a severe allergic reaction. This medication acts on the whole body to shut down the allergic response as quick as possible. Once the drug epinephrine, also known as adrenaline, is injected into the body, it only will buy you some time. You need to continue to monitor the patient until emergency services personnel have arrived on scene. When do you use an EpiPen? An EpiPen is used when you suspect an allergic reaction is occurring and the person is having trouble breathing. Another name for a severe allergic reaction is anaphylaxis, also known as anaphylactic shock. Severe allergic reactions can be life-threatening. Injecting epinephrine is the first step in helping that person. However, 911 still needs to be called. If you are alone with the person suffering from an allergic reaction, or you yourself are having an allergic reaction, you first must inject the epinephrine, then call 911 immediately after. If you're with a third person, direct that person to call 911 immediately as you assist with the injection of epinephrine. Remember, it's so important to stay calm and stay present. Some of the common signs and symptoms of an allergic reaction are dizziness, scratchy throat, redness, hives or raised welts, itching, weakness, shortness of breath or wheezing, and dry mouth. Although all of these are signs and symptoms of an allergic or severe allergic reaction, it is not necessary to have all of them to be in any sort of distress or anaphylactic shock. Here are the 5 steps to safely administering an EpiPen. First, you must remove the EpiPen from its storage container. Second, find and remove the safety cap that all auto-injectors have. Once that safety cap is removed, the needle is ready to be injected. With a swinging motion and with some force, inject the epinephrine through the auto-injector into the outside thigh of the person experiencing an allergic reaction. Remember to always stay calm and comfort the patient. It's likely they'll be having trouble breathing, and any anxiety or extra excitement will accentuate and make breathing more difficult for them. The auto-injector should stay pressed against the outside thigh of the patient or a person having the allergic reaction for approximately 10 seconds. Remove the pressure from the auto-injector and place the EpiPen in a safe location. It'll be discarded by emergency services personnel once they arrive on scene. When it's time to use the EpiPen, swing your arm with force toward the patient's outside thigh, securely holding the EpiPen in your hand. Push the EpiPen into the thigh until you hear the needle click. Hold the EpiPen against the thigh for approximately 10 seconds with pressure. Remember to keep yourself and the patient as calm as possible. Step 4. Remain calm. It is vital that you stay calm because that will help the patient stay calm. Control your breathing, keep a present mind, and assure the patient you're doing all you can to help them. Let the patient know that you will not leave them, and that emergency services personnel are on their way. Step 5. Safeguarding the EpiPen. Now that the EpiPen has been used, remember it is a needle and needs to be disposed of safely. Place it in a spot that is safe and note the time the epinephrine was administered. When emergency services personnel arrive on scene, they'll want that information and they will take your EpiPen and dispose of it properly. If after 15 minutes the patient has not shown signs of significant improvement and emergency service personnel have not arrived, a second dose of epinephrine can be administered. If giving a second dose of epinephrine is what you need to do, consider giving that second shot in the opposite thigh. Here are some takeaways from today's training. Call 911 as soon as it's possible. Administer the EpiPen. Stay calm and keep the patient calm. Once the EpiPen has been administered, continue to monitor the patient and help control their breathing. Note the time the EpiPen was given. Keep the needle in a safe place until emergency services personnel arrive and they can dispose of the needle safely. Remember, stay calm, stay present, and save a life.